Hi everyone, this is your girl Nurse Keke. I'm bringing this video because I get a lot of questions, whether it's from my family, friends, patients, about nursing and how to become a nurse, what's the process, a day in the life as a nurse. So I just decided to make a YouTube channel just to explain and just to talk about nursing, being a nurse as a military wife, doing nursing, different places internationally. And so this is just my channel, and thank you for coming to my channel, and I hope you enjoy. And any types of comments or questions, leave below and I would gladly be able to answer those questions for you. So with further ado, we're going to talk about the difference between ADN versus Bsn. ADN is a associate's degree in nursing, and it's a 2-year process. You do your prereqs and then you do your actual nursing classes. Then you graduate and you take the NCLEX. Whereas Bsn, it's usually at least a 4-year process because you do 2 years of prereqs, you take your nursing entrance exam, and then you do the nursing program, you graduate, you take the NCLEX, and you become an RN. The biggest difference I can say between ADN and Bsn is, first, with the ADN, that's more of a lot of non-traditional college students take that route. So when I mean non-traditional, I mean like people who have like families, or it's not their first time going to college, or they're also working full-time jobs while going to school. So you may see a lot of really grown adults going to doing the ADN route versus the Bsn route. And I think the reason is because for one thing, pursuing school, nursing school at a school that's ADN, which usually is community college, the tuition is way cheaper than pursuing a Bsn at a university or 4-year college. For example, like I attended Central Texas College in Killeen, Texas to get my ADN, and my overall cost for my the RN program there was $5,000, whereas my other friends or people that I knew or associates that went to Baylor, they were paying at least like $30,000 a year for their program, whereas mine altogether was $5,000. So you may see a lot of like I said, a lot of working adults choose to go the ADN route because it's more cheaper and you're able to get your RN license quicker. Another reason you're able to get your RN's license quicker with the ADN program is because of prereqs. I previously mentioned that, with ADN you have to take prereqs, and Bsn you have to take prereqs, but there are a big difference between the two. For example, when I attended Central Texas College, for sure I would say CTC. When I attended CTC, my prereqs was English Composition 1, Anatomy and Physiology 1, which is A&P 1. It was Pharmacology, and it was I'm thinking microbiology. Now, if you attend a school where you get your Bsn, you would take those same classes, plus you would take additional classes like college algebra, you would take statistics, you would take history 1 and 2, you would take pathophysiology. It's just so many other classes that you would take. So you will literally take 2 years of prereqs pretty much, and then you take the nurse entrance exam and you apply into the nursing program, and if you're accepted, you start. Another thing I want to point out, I pointed out the big difference between the two, but it's also some things that are comparatively the same between the two programs. Whether you do ADN or Bsn, you have to take a nursing entrance exam. Now, the nursing entrance exam is depending on what school you apply for. It is not the same exam for every school. So for my school, for example, I took the HESI A2. Another popular one is TEAS test. Some school may ask you to take TEAS. Some school may ask you to take HESI A2. Some school may ask you to take the NCLEX. I'm sorry. And it just depends on the school. What I would say, depending on what school you go to, do your research, find out what entrance exam you'll have to take. And most of those schools will also provide you with additional resources to practice with and for help. So look for that. And you can also usually buy you can usually buy, I'm sorry, I'm getting a brain fart. You can usually buy the practice books at your school bookstore. So just, you know, ask questions. I'm pretty sure you'll be able to find the resources that you need. Another thing that I want to talk about comparatively about the two is when you're initially getting your RN license. And remember, in order to get your RN license, you have to go to a college, whether it's a community college or a four-year college or university. You have to go to the school. You have to take your prereqs, also take the nursing entrance exam. You have to meet all the requirements. You have to actually apply to the nursing program. You have to be accepted, and then once you're accepted to the program, then you can start the nursing program. You have to successfully graduate from your nursing program to be eligible to take the NCLEX. And then once you take the NCLEX and pass, that's when you receive your registered nurse license for whatever state you're trying to practice in or you're applying for. So those are basically just a quick rundown of the steps of becoming a nurse. And whether you do an ADN or Bsn, you will have to still do the same process. Now, with that being said, when you're initially applying into a nursing program, let's say you do not have any type of nursing license at all, you're trying to become a nurse for the first time, whether you take the ADN route or the Bsn route, you will have to go into the actual classroom to be able to go to clinicals, to learn. You have to physically be there. Now, once you receive your RN license, whether you took the ADN route or the Bsn route, then you're able to apply to programs where you can like go from ADN to Bsn. You can completely do that online, or you can have your Bsn and want to get your master's or your doctorates, and you can completely do that online. But when you're initially getting your nurse license, you have to attend a classroom. It doesn't matter if you're doing ADN or Bsn. Now, I will also want to put in a little mention in there to say, I don't know if that's changed because of COVID, but when I was doing the nursing process, and a lot of my friends and associates that have done the nursing process as well, the nursing program as well, when we all got our license initially, we had to be in a classroom. So that could have changed now because of COVID. They may allowing people to do it online or not, I don't know. But for me, and I had to physically be in a classroom. But right now I'm going from ADN to Bsn. I already have my nursing license. I'm already a registered nurse. I've been a nurse now for 2 years. So now I'm going to get my bachelor's degree completely 100% online. And just to recap everything, the biggest difference, the highlighted points I want you to take home is the biggest difference between the ADN and Bsn program. With the ADN is usually is a 2-year program, and then you're able to get your license quicker just because you probably have a few prereqs, not that many, and then you apply it to the nursing program. Whereas with the Bsn route, you'll have 2 years of prereqs, and then you have an actual 2 years of the nursing program. So in all, that equals up to at least 4 years. Another big difference is the amount of money you would pay. ADN usually it's a cheaper route to go versus getting your Bsn, because with getting the ADN is associate degree in nursing. With getting a Bsn is a bachelor's degree in nursing. Another big difference is you may find a lot of non-traditional college students taking the ADN route because they're able to get their license quicker, and a working family, and they usually have other responsibilities and obligations, so they may tend to go the ADN route. And if a time is of an essence for you, it may be better to do the ADN route. Whereas the BSN, you may see more traditional students taking that route, which means like college age, young college age college students taking that route, because they can go straight into the program and do 4 years, and maybe time is not an essence for them because, you know, they're young, and, you know, a lot of young college students tend to take the BSN route. But either route that you take, there's nothing wrong with it. Like, whether you just got to figure out what are your priorities, and what appeals to you the most. For some people, BSN may appeal to them because they're like, hey, I could go straight into, I can, you know, do my prereqs, and then get into a nursing program, and once I graduate, I have my bachelor's degree. I don't have to worry about doing my bachelor's degree. Whereas somebody else, the ADN may appeal to them because they're like, yeah, you know, I'll go in and I don't have as many prereqs I have to take, and, you know, I go straight, get into the nursing program, graduate, and if I want to further my education, then I can do that while actually working as an RN. But you just have to depend on what's best for you. Whichever route that you choose, understand it's going to be work, and it's going to be a sacrifice, but it's not meant to scare you. Anything that's worth having is worth putting work into. And just setting your priorities, getting everything right, and having a good support system within yourself and with other people around you. And I hope that this video helped a lot of people with deciding whether to do the ADN route versus the BSN route. Like I said, I personally took the ADN route, and I wouldn't change it for anything. It was a lot that I learned, and I felt like I got a better personal hands-on experience. So it's just, you know, your personal choice, but definitely pray about it, and you know, just figure out what's best for you, like I said, and leave all your comments below, and any questions that you may have, leave it below too, and let me know what kind of videos you guys want to see, and I'm very willing to do those videos. I mean, whatever nursing questions you may have, or videos you think would be very informative, or you just inquisitive, it doesn't matter, but just let me know. And thank you again for watching my channel, Nurse Keke.